This video is on contraception. Contraception means to avoid pregnancy and can be either hormonal or a barrier contraception. It is important to note that contraception is not 100% effective and only condoms prevent STIs. We will not cover innate contraception such as abstinence or having a bad personality. Let's start with hormonal contraception, and a common one is the combined oral contraceptive pill. As the name suggests, the pill combines estrogen and progesterone, the two main hormones that regulate female fertility. The estrogen provides negative feedback to inhibit ovulation, while progesterone thickens cervical mucus, so the sperm finds it more difficult to reach the egg, as well as thinning the endometrium to reduce chance of implantation, even if the egg becomes fertilized. Side effects include initial breakthrough bleeding from the vagina, which can be concerning but is normal, as well as headache, deep vein thrombosis, and subsequent pulmonary embolisms and nausea. For this reason, it is contraindicated in migraines as well as hypercoagulable states, such as cardiovascular disorders, a past history of DVTs or PEs, and pregnancy. Also in estrogen-dependent tumors such as breast cancer, because you do not want the exogenous estrogen driving the tumor. The timing of taking the pill can be complex, and it is important to provide thorough patient education, and we will outline here some of the salient points. So the most simple timing is to start on days 1 to 5 of the cycle. This image shows a pack for a 28-day cycle. Take one a day and work down the hours of the package. It is important to take the pill at the same time each day, because if you miss it by even a couple of hours, it counts as a missed pill. If you miss a pill, so you miss only one pill, you take the missed pill as soon as possible and continue as normal. If you miss 2 or more pills, do the same as if you missed 1 pill, but additional contraception will be required for a week as the pills will not be working effectively. But sometimes it's hard to plan and you get happily surprised, in which case even if there's unprotected sex, you can use emergency contraception or the morning after pill. It is not meant to be used as a regular contraception just if you get caught out. The pill contains oral levonorgestrel, which is a progesterone analog, so thins the endometrium and thickens cervical mucus. It must be taken within 72 hours, but the longer you wait, the less effective it is. Another form of levonorgestrel is the levonorgestrel releasing system, known as the Mirena IUD. IUD stands for intrauterine device and is a procedure performed by a doctor as it is inserted through the vagina and opened at the endometrium and can be used for 5 years. And is useful when estrogen is contraindicated, such as headaches or clotting issues as we talked about before. Side effects include irregular bleeding or spotting, nausea, and feeling bloated. As the image shows, there's also a string projecting into the vagina, which can feel weird for the female, and partners may initially complain about it if they feel it. But it is important to not cut the string, as it makes taking it out so difficult. The partner should get used to it, but if you want to take it out, see the doctor. Progesterone can also be given as a subdermal implant or under the skin in the arm called Implanon, and lasts 3 years. It has a similar mechanism of action to Mirena due to the presence of progesterone. Barrier contraception such as condoms is ideal because it also prevents against STIs, but sometimes males can complain about the sensation and spontaneity, so exogenous hormones that cause all those side effects are taken on by the female. If the couple is certain they do not want future kids, sterilization in the form of vasectomy or tubal occlusion can be performed. Thank you for watching. If you learned something, please tell a friend who may also find it useful.